it's never too late to actually make a change, whether you're in your 70s, you're in your 50s, you're in your 30s, or you're 5 years old. Everyone can start making a change now, but I implore people to not lose the enthusiasm when COVID-19 is done of trying to keep yourself healthy. Not only try and keep yourself healthy, try and keep those around you healthy. And by coming together as a community and just encouraging healthier behaviors, not only will it make us live longer and a healthier life, but I think it will really put us on a much more sustainable trajectory for our nation.
Hello and welcome to Health and Humanity with Dan Voss, a health podcast show centered around living healthier lifestyles and improving our human connection and relationships. I have with me today Dr. Nicole Saphier. Dr. Saphier is a full-time practicing board-certified radiologist at Memorial Sloan Kettering in New York City, and a nationally known medical contributor and regular guest anchor for Fox News Channel. Passionate about patient advocacy and individual responsibility, Dr. Saphier has worked on numerous healthcare legislations that have guaranteed Americans early access to disease detection and education. She also holds advisory positions at the Centers for Disease Control and Prevention and the New Jersey State Department of Health. Dr. Saphier has just released her new book, Make America Healthy Again: How Bad Behavior in Big Government Caused a $1 trillion crisis. Dr. Nicole Saphier, you are a very busy woman, especially at a time like right now, so I appreciate your time and for you coming on the show.
Absolutely. I'm happy to be here.
Yeah, so I want to talk about your new book, Make America Healthy Again. Why this topic? Why did you want to write this book specifically?
Well, so I'm a mother of 3 boys, and as my oldest was getting ready to go off to college, I needed to channel some of those emotions somewhere. And so the concept of writing a book came to mind. And so I thought of, all right, well, what is it that I feel passionate about? And, after a long time of thinking about it, for my profession, I'm early detection of cancer, specifically breast cancer, head and neck cancer. And I deliver a cancer diagnosis to someone just about every single day.
Wow.
And one of the things that I find quite tragic is that it takes a cancer diagnosis to then prompt someone to actually want to live a healthier life and want to kind of do better for themselves and their families. It just brings this level of an awareness to them. And so although I know that it's great to, at that point, lessen disease through good lifestyle behaviors, I started wondering, well, what if we could actually prevent it altogether? So I started doing some research on that and, in very basic form, what are our leading causes of death and how much is it actually costing our nation? Because more and more you keep hearing these debates from the right and the left for single payer versus not single payer. And, I'm trying to want to decide, well, who's right in all of this? And it occurred to me that no one's right. And none of these health policies are actually going to work if we don't start focusing on our chronic illness problem in our country, a lot of it which may be preventable. And if we actually started preventing some of this disease, this costly disease, not only would people live longer, healthier lives, but maybe we would actually be able to pass some health policy that would move us in the right direction.
Yeah. I feel like we've, over the decades, have really politicized the topic of healthcare. What are your thoughts on that? Do you think, because from what I see, it's almost as if it shouldn't even be a political issue. It shouldn't be a left-wing, right-wing issue, but we've made it that way because we've made so many other topics and issues politicized. What are your thoughts on that?
Well, it seems like everything's quite polar right now, and everything seems to be getting politicized. I mean, even a global pandemic is. But the bottom line is the reason that people are so passionate about healthcare is because it affects all of us. For some people, if you're talking about immigration or if you're talking about taxes or, various other forms of legislation, it doesn't necessarily reach every single American. But healthcare does, because at some point in our lives, everyone, either yourself individually or your family member, will need some sort of health services. And that being said, it's not just it's something you need. Paying taxes is very black and white. We all do that. But when it comes to healthcare, you're actually put in a vulnerable position. And so it's playing on that vulnerability. And politicians are really good at playing on our insecurities and our vulnerabilities. And so they essentially say, I'm the one that's going to save us all. And the bottom line is, left, right, and everything in between, nothing is going to work right now if we don't actually look at the fundamental problems with our healthcare system. And in my book, I kind of, I break it down. It's not a scholarly book whatsoever. It's certainly not a self-help book whatsoever, but I talk about the leading causes of death and disability in the United States, from cardiovascular disease. I talk about cancer, mental health, opioid crisis, physician burnout. And I talk about, how much of that is in our society, what it's actually costing our society in terms of money. And then I did a bunch of research into how much of it could be potentially prevented. And I talk about some very easy, pragmatic ways to actually prevent some of this disease. And then it goes into, well, if we actually prevented, we're not going to prevent all of it, but if we prevented some of it, just that lessening the demand side of the equation will actually make the healthcare system, whether you want single payer or private healthcare, function much better because you've lessened the demand side of it. So all of a sudden you're allocating resources to other places of need.
Sure. Wow. Well, let's take, what we're dealing with right now with the pandemic, with COVID-19, and specifically chronic illness, chronic disease. You look at a large portion of Americans have at least one chronic illness. So how can the idea of living healthier lifestyles, maybe considering food as medicine, how can that help prevent chronic disease, especially during a time like right now?
Well, it was interesting timing for my book to come out. I mean, mind you, the publication date has been set for over almost about a year now,
Yeah, that's
but
wild
it
timing.
happened, it came out in the middle of this pandemic, with all bookstores closed. But interestingly, the content of the book was incredibly relevant. And as we're seeing with COVID-19, that the Americans essentially have made themselves vulnerable because of our chronic illness epidemic that we've been dealing with, which is what my book is all about. It's trying to bring it to light. So in the United States, it seems right now, those that are dying or severely affected by the novel coronavirus are the elderly, but also those with chronic illness. And as you mentioned, about 60% of American adults actually have at least one chronic illness. 40% have two. So when you look at the data in New York alone, the people who are dying of COVID-19 have these comorbidities, or they're overweight. And being overweight, that excess body weight itself increases your risk of COVID-19 death as well as chronic disease, because excess body fat increases inflammation throughout your entire body. Not only does it lead to diabetes and heart disease and certain diseases, but being overweight itself lowers your immune system. And that is what we're seeing all across the United States, because unfortunately, the United States leads the globe in obesity. And right now, what you're hearing is people trying to compare how the United States responded versus Sweden. And for me, I almost chuckle, but then I get a little upset, because you cannot compare the United States to Sweden. When they're going with herd immunity, they're having a lot of deaths there. But let me tell you something. Sweden has less than 9% obesity rates throughout their country.
Yep.
The United States, we're approaching 50%. And that's not just our adults, those are our adolescents too. We're seeing increased obesity as well as increased diabetes in our adolescents. So we are on a very bad trajectory here in the United States. And everyone right now is doing everything they possibly can with these stay-at-home orders, because everyone is trying to stay as healthy as possible. But we can't just be so myopic to try and stay as healthy and avoid this virus. What are we going to do long term? This virus is still going to be circulating. So I don't want people to lose the enthusiasm of trying to live a healthier life. So what can you do right now, not only to protect yourself from the virus, but the consequences of having a chronic disease with the virus?
I love that. I've said this several times in the last several weeks about everything going on with the pandemic, that this is hopefully a wake-up call for many people to look at their lifestyle and look at their health and see where they can improve certain things. And you don't have to improve it overnight, but if you can make small changes over time, you're going to have big results. And I think one topic there is obesity. There's a number of other chronic illnesses. We have diabetes, high rates of diabetes in this country. And I'm not trying to make light of certain diseases. I understand that certain diseases are not preventable, and you got the short end of the stick with health. But majority of the diseases that we have in this country are preventable. So I just hope that this is a wake-up call for us to look at where we can improve things. In terms of nutrition, what are some things that you see that you're just like, whoa, this is a big red flag on what we're doing here? I know you've talked before about our intake of sodium in our diet. What are some things that you're just a little concerned or very concerned about with the typical American diet?
Well, I actually go into a lot of it in the book. I talk about how big food industry has really just changed things for us. I
Yeah.
mean, we're living in a time of instant gratification. We want things and we want things now. And it's not necessarily because we're lazy. We're just all doing a lot. We're working hard. We're busy. My hypothesis is the unhealthy eating kind of started around the time that women really ventured out into the workforce. Myself, I'm a full-time working mom of three. And for everyone to come home to this big home cooked meal full of fresh fruits and vegetables and lean proteins, I'm tired. I don't want to do that 7 nights a week. And so, yes, sometimes you want to eat out, you want to order in, or you're getting some of the stuff from the grocery store that's just, a little easier to prepare, that takes less time. And unfortunately, those have preservatives in it. And you said something interesting in that, it's little changes over a long time. Right now, we live in a society, again, going back to that instant gratification, that we want results and we want it right now. We want the latest fad diet. We want the Instagram filters that are just going to make us look great for that moment, that snapshot. But people really have a hard time in putting the effort for long-term results. But unfortunately, those long-term results are what's going to be sustainable. So for me, and I talk about this in the book, actually at the end of the book, I put together this little appendix. Mind you, again, this is not a self-help book, but I'm like, you want to make some changes? Here are some really easy things that you can do. And because it's not about following the latest keto diet or paleo or whatever it is, it's about making these interval changes that are sustainable for the long term for you and your family. Increased sodium intake is a huge one. I mean, for me, living in the New York City area, a lot of people like to go out to eat. And the truth is, you will have significantly more sodium by going out to eat. So if you're someone that likes to go out to eat 3 to 4 times a week, why don't you just go out 1 to 2 times a week? Everything in moderation. It's not all or none. I talk about certain additives that I like to use when I'm cooking instead of salt, but at the end of the day, you're going to still add some salt, but you at home will be adding less salt, most likely, than if you were to go out. The processed foods in the grocery store, you want to try and shop in the periphery, in the fresh fruits and vegetables and meats, and everything in the center tends to be a bit more processed. Again, that doesn't mean you can't have any of it, but just try and have less of it. Whatever you're doing right now, you can just do a little bit better, and it's going to make a big difference. Just make any sort of changes. And that goes the same with exercise as well. We're not all going to be gym rats and fitness models. I certainly am not, but we can all be moving just a bit more. There was an interesting study that was pulled data from fitness trackers right now while people are kind of in these stay-at-home orders. And they were saying people are moving a lot more. And I was like, okay, we're trying to find that little silver lining here of all these stay-at-home orders.
Sure.
No, I don't think people are automatically getting physically fit right now, because I think this is actually a really bad time for physical and mental health. However, what that does tell me is people aren't in their office. They're not doing their sedentary day jobs. So they're moving around more. I can tell you myself, I'm having to go up and down stairs and check on my kids as they're distant learning and making sure I have dinner going. And so, yeah, I'm moving a lot more during the day. Whereas if I were just sitting at the hospital all day, I would have been more sedentary. But some of the changes that I made before all this happened, because I recognized that I didn't really have a lot of time to go to the gym every day, I would get up twice a day, walk the entire circumference or the perimeter of our building, making sure that I was moving. I stopped using the elevator and I just was using stairs. And just those little small changes can really go a long way. You just need some moderate exercise throughout your day. And moderate exercise doesn't necessarily mean you have to be pumping iron. It just means you have to be vacuuming or doing stairs or jumping on the trampoline or playing soccer with your kids. I mean, all these things that you could be doing that you're not, just because there's a lot of people are blocked. They're saying, I don't want to exercise. I don't like to go to the gym, but it's not exercise. It's physical activity.
Right.
And there are a lot of ways you can have physical activity.
For sure. That reminds me of, I just listened to Dr. Mark Hyman. He has a podcast, and he just had Ben Greenfield on his show. Ben is a big guy in fitness and health area and online. So anyhow, Ben was talking about how in our modern day culture we have made going to the gym and working out for an hour and having this soul crushing workout like we've glorified that. So he made the example of hundreds of years ago, thousands of years ago. If you were to do that intensive a workout, you were likely a gladiator, a warrior, a soldier. Like you were training because you weren't necessarily going to be living for very long, but you were expected to potentially be attacked, and you had to be strong enough to not be killed. And then you compare that to the post-industrial era where for most of us, we sit 8 hours out of the day, or more than that. If you come home after work and you're on the couch, most Americans sit pretty much all day long. And then we try to make up for that by having that 1 hour intense workout in the morning or at the end of the day. So what he talks about is having, he called them movement snacks. And instead of going to the pantry or the refrigerator to have a snack throughout the day, have these little 3 to 5 minute exercises. And it can be a kettlebell, it can be push-ups, it can be a pull-up bar, it can be squats. Like you said, if you have kids, go out in the backyard and toss the ball around with them. Just get into that mindset of movement. It doesn't have to be, 1 hour soul crushing workout. It can just be that mindset of I'm going to move throughout the day. So I just thought that was fascinating and very interesting timing. I literally just listened to the podcast yesterday. So I think it's kind of spot on for what you're saying there.
Well, as someone who's not a fitness expert, I'm glad to hear that those experts do feel the same way.
Right? Yeah, absolutely. And then another thing you were touching on, and actually in that interview too, they talked about fad diets, and it seems like every single fad diet that we hear about, of course they promote it as like, this is the one, this is the diet for everybody, whether it's paleo, whether it's vegan, whether it's carnivore diet, vegetarian, whatever it is. Of course they're going to market it to be like the one. What are your thoughts there on people maybe experimenting a little bit more on what works for them, what's the best diet for them, and then once you land on something, give it a try and see if that can fit in with your lifestyle?
I am happy for anyone who can find a diet that they can commit to. The problem with a lot of these restrictive diets is they're only good for the short term. And unfortunately, they're not sustainable, and people end up not only regaining weight, but then potentially gain more weight in the end. So for me, it's whatever you can commit to for the long term. And so I don't like to think of it as a diet. It's incorporating certain foods into your and your family's lives that you just want to be eating. Does that mean that you can't go and get McDonald's French fries occasionally? No, of course not, because I think that you should be able to. I just think that it is, if you are eating healthy the far majority of the time, then you can actually have those small splurges, because it is everything in moderation. For me, couple of things that I really looked at when I was writing my book, and I talk about it a bunch, are the blue zone regions throughout the globe. And these are areas where people tend to live much longer, healthier, and more coherently throughout the globe. You see areas in Italy and Greece, and there's actually one in Loma Linda, California. But essentially, you see a lot more people living over the age of 100 than anywhere else. So they did a lot of research into why this is. And it boiled down to two things. One of them, of course, being the diet. And diet kind of just goes back to the whole Mediterranean lifestyle, which is a pretty common sense. High fruits and vegetables and lean proteins. You're not having processed sugary carbs, the complex carbohydrates. You have meats in there, but they're not necessarily the very fatty or certainly not fried meats, but the lean proteins and fish, and then the oils. It just makes sense why this would actually equate to a healthier life. But that being said, they also drink red wine. And so, it's not all or nothing. But then they also looked at the exercise portion of it. And this goes into what we were just talking about. A lot of the people, no one's going to the gym. There were certainly no bodybuilders in this group, but a lot of them were shepherds, and they walked a lot of their days. There were no high interval training. It was just constant movement and not being sedentary. And then the last piece, which I find so crucial and which is one of my biggest concerns right now during COVID 19, is the social connectivity. So it was a long term healthy diet, sustainable, constant physical activity. And then it was just this feeling of being a part of a society. So even grandpa or grandma, even in their 90s, they weren't cast aside as that crazy old lady. Don't listen to what she's saying. She was the matriarch and she still maintained that level of respect.
Hmm.
And late in the night, she was still gathered with her friends, or the old men were out playing dominoes, sipping their wine. And it was just this constant being a part of a community, of a place and a family. And that they believe really added to just their being coherent and being able to live healthier longer. And so, as we're seeing with COVID 19 right now, it's a little bit easier to eat healthier because we're cooking at home a lot
Mm-hmm.
more, not as much takeout. We're certainly not going out.
Sure.
So, people can focus more on the produce and healthier living. In terms of physical activity, we just mentioned people are walking a lot more. I've never looked out my window and seen more people walking in our neighborhood. But the concept of staying socially connected is a big concern. And in this time where people are having increased anxiety from the economic fallout, and we're
Mm-hmm.
seeing, over 30 million people filing unemployment, I worry about the long-term mental health aspect,
Yeah.
which is a big point that I talk about in my book, that it doesn't matter if we do everything for our physical health. If we're not also focusing on our mental health, what's the point of having a healthy body if our mind isn't also healthy?
100%. I want to touch on a few things there. I'm happy you brought up the topic of blue zones because I find that topic very fascinating. And I'm also happy you brought up the idea of the social aspect because I was actually going to ask you about that as soon as you started talking about blue zones. Um, First off, I'm happy to hear that red wine consumption is a good thing because that makes me feel a little bit better about my habits. But I also find it very interesting that social aspect because I have read and researched blue zones and really centered in on that social piece. And it makes sense, right? When you look at people that are out and about with people in their community, like you said, it could be family members, it could be hanging out with grandparents or your kids or your next door neighbor. Unfortunately, and maybe it's just prior to quarantine, I think we lost sight of that social aspect where we just got into the rat race of life, where we're always on the go. And again, hopefully it being a wake-up call, this time can be a time for us to slow down a little bit and call mom and dad more frequently and say hi to your neighbor, your next door neighbor, when you see him out on the lawn, and have a conversation. Right now, social distancing, but just get back to that mentality of we're a community and we need social interaction. And I find it interesting you brought up right now that is a challenge, in terms of physical face-to-face interaction, but there's still ways that we can have that social aspect. I find I'm calling my mom and dad a little bit more frequently than I did before. Probably not as much as my mom would still like me to, but you can still do FaceTime meetings and interactions and Zoom calls. And there are ways, I know it's not the same, but there are ways to still hold on to that social aspect. That's all really fascinating stuff. So I appreciate you sharing that. I want to pivot just a little bit to your specialty of cancer. You're a radiologist. To what extent, and I know we've talked about chronic illness and what we can do to prevent certain chronic illnesses. To what extent can we prevent cancer or certain types of cancer with our lifestyle choices?
Well, it's interesting. So, breast cancer, the biggest risk factors are being a woman and getting older, and not much you can do about there.
Mm-hmm.
However, there are certain things that do increase your risk of breast cancer, such as being overweight. But when we're talking about cancer, anywhere up to 40% of cancers could potentially be prevented. And that's alarming because cancer is such a devastating diagnosis. I mean, most people know someone that has been diagnosed with it. And so most people don't actually think like, I could have prevented cancer. Now, granted, there are a lot of cancers that you cannot prevent. It is in our DNA, it is in our environment, and there's nothing we can do about it. But wouldn't it be great to be able to focus on those patients, focus on those cures and their research,
Mm-hmm.
instead of being diluted because we're having to care for all those that are potentially preventable. Now, we can't say, well, we're not going to take care of the people who could have prevented their cancer. I mean, what kind of society would that be? But the bottom line is, with freedom comes responsibility. And so an example I like to give people is the HPV vaccine, human papillomavirus. Most women know what HPV is because when you go to the gynecologist appointment, that's the purpose of a pap smear, essentially looking for cervical cancer, and which is caused by this virus called HPV, sexually transmitted disease. And so what we found out in our research is it's not just cervical cancer that is caused by HPV, but oral, throat, tonsillar, a lot of cancers are. And as we've gotten more smart and intelligent with identifying certain cancers, we're realizing that this one virus causes significantly more cancers than we ever imagined.
Wow.
Also very difficult to treat. Head and neck cancer is one of the most awful cancers to deal with. In Australia, so there's a vaccine for HPV. Some people know about it, some people don't. In Australia, they made the HPV vaccine mandatory in adolescents to prevent cancer in adulthood, because you get the HPV virus usually when you're an adolescent or a young adult, with more sexual promiscuity, and the cancer develops later on. So Australia essentially made the vaccine mandatory. They have essentially eradicated cervical cancer from their country.
Wow.
Here in the United States, we although our public health officials recommend vaccinations, it's really hard for us to mandate them. And again, that's because our countries are different. But again, with freedom comes responsibility. And so as we're seeing with COVID-19 and the flu and measles, vaccinations are responsible in the sense that you're preventing illness, not just in yourself, your children, but your community around you. And so one huge way to actually prevent a lot of cancers would be to undergo the HPV vaccination. There's also a vaccine for hepatitis B. So in high-risk people potentially should be getting that. But the problem is a lot of people don't know, and a lot of people are undereducated. I don't necessarily think that most people are obstinate and don't want to help, but I think it's more about education. And unfortunately, in the era of digital media, we have a lot of anti-vax movements, and there are some very legitimate concerns, but I think that you get a lot of bad information and misinformation mixed in with some good information. Yeah.
I think that's a really important takeaway, is that with freedom comes responsibility, and that really can be applied to so many areas of life, not just preventing disease or preventing cancer, but just in general. I think that's a really great message.
Well, and I think anywhere up to 15% of American adults are still smoking cigarettes. I mean, at this point, that's astonishing. Now, we don't want to go back to the Prohibition era, but cigarette smoking is directly linked to lung cancer, lung disease, which is causing people to die from COVID-19, not to mention many other diseases like kidney cancer, bladder cancer. And if you excess alcohol intake, think about it this way. Alcohol is so toxic, it essentially increases the risk of cancer of everything it touches on the way out, from the mouth to the esophagus, to the stomach, to the liver where it's filtered. I mean, it's just this whole sequence of events. And so, I for one, drink alcohol. I am not going to say that I don't. Like I said, I'm not a wellness expert. But everything in moderation. And there is a certain extent of what you can do, and you have to take responsibility. No, you should not be coming home and drinking an entire bottle of wine by yourself every night. That's excess. But there are actually certain alcohols that have lower calories, lower sugar content, that could actually be better for you. Not that it's going to be good for you, or I'm ever going to really recommend you drink alcohol. But, for some people, that is what they want to do socially. But there are smarter ways to do it.
Absolutely. Yeah, I know. Just a little bit ago, I joked about, consuming red wine, and I do enjoy red wine, but like you said, in moderation. But in some ways, I feel like we lose track of the reality of alcohol being a poison to our body. Yes, you can enjoy it in moderation, but for some people, they lose sight of, like, this is really bad for your body.
Well, and one thing that I'm concerned with COVID right now is, it's not Monday through Friday is the work week and then Saturday and Sunday. It's just Monday through Sunday.
Mm,
And, alcohol intake is certainly going up. I can tell you it did for me in the beginning
yep.
because every day kind of feels the same. And
Hmm.
so you almost feel like your Wednesday night is your Friday night.
Hmm.
And, you really just want to be conscious about it. And at the end of the day, you want to make sure that you're not drinking because you need it.
Right.
And it still maintains that should just be that level of social connectedness if you like to do it with your friends or if you like to have a glass of red wine with your meal. I mean, it's all in the blue zone, so why not? But, you just really want to make sure you watch your intake because it is a poison. But again, we live in a free country and we have those freedoms. And I am so glad we have those freedoms. But again, with freedom comes responsibility.
Yeah. I'm happy you mentioned moderation. That's a saying my dad always says is everything in moderation, and said that since I was a kid. And as I get older, it's really hitting home now on so many different areas in life. Very good. So before I get to my last question for you, Dr. Saphier, I want to start off or finish off, I should say, by wishing you a happy Mother's Day. At
Oh,
the time
thank
of
you.
this recording, we're a few days away from that, but this will be coming out this upcoming Monday, which will be the day after Mother's Day. And I know you're a mother of 3 boys. Is that right?
That's right.
Yeah,
They're all
great.
home with me.
Yeah, that's interesting. I really have a lot of sympathy for parents right now who are just kind of thrown into the role of being a teacher now. It's not an easy time for that, but I do want to wish you a happy Mother's Day and to all of our other amazing mothers out there.
Thank you.
Um, and then another thing is, where can people find you? I would imagine they can find the book just about anywhere online. Is that right?
That's right. So my last name is pronounced Sapphire, but it's actually spelled Saphier. I mean, you can Google me. I have a website that talks a little bit more about me. I'm on Twitter. I'm on Instagram. My book, Make America Healthy Again, you can get it anywhere books are sold. It's certainly on Amazon, but there are also some great websites that support local bookstores called bookshop.org and indie books or something like that.
Hmm.
But, I know a lot of people right now are really wanting to help their community. So I do implore you to kind of go out and see how if you're going to buy a book, see if there are some smaller websites that might be able to help too. But Lord knows I order from Amazon all day, every day.
Yeah, yeah, it's very easy, but I appreciate pushing the smaller shops as well. And I'll have all of that linked up in the show notes as well for our listeners and our viewers. All of those links will be in the description and the show notes. Great. So my last question for you is, who do you want to impact the most with your work?
Oh, that's a great question. That's a loaded question for a last question. For me, I think the big thing right now is we need to start teaching our younger generation how to live healthier lives. It doesn't matter how old you are still, it's never too late to actually make a change, whether
Mm,
you're in your 70s, you're in your 50s, you're in your 30s, or you're 5 years old. Everyone can start making a change now, but I implore people to not lose the enthusiasm when COVID-19 is done of trying to keep yourself healthy. Not only try and keep yourself healthy, try and keep those around you healthy. And by coming together as a community and just encouraging healthier behaviors, not only will it make us live longer and a healthier life, but I think it will really put us on a much more sustainable trajectory for our nation.
hmm, that's great. I appreciate that. Dr. Saphier, I really appreciate your time. I know you're very busy, especially during a time like right now, as in a global pandemic. But we really appreciate all of your work and all of the work of all healthcare workers right now and anybody on the front lines. We truly appreciate everything you're doing. So thank you again for your time, and I hope you have a great day.
Thank you so much. Great being on.
Thank you. Take care.